Dr. Akhtar Hussain, he is President-elect of International Diabetes Federation, Professor in Global Health, Chronic Disease Diabetes, President Diabetes Asian Study Group, DASG 2018 to 2020, Vice President IDF 2013 to 2015 and 2016 and to 2017, Member of the Finance Committee IDF 2016 to 2017, Chair of the Consultative Section Science IDF, Member and Co-Chair of the Bridges Committee IDF, Member of Norwegian Diabetes Association, Executive Member Medical Board Norwegian Diabetic Association, Life Member of the Diabetic Association of Bangladesh, Founder and Life Member Diabetes Association, Diabetes Asian Study Group, Co-Editor Journal of Diabetology, Official Journal of DSG, Primary Faculty Member, Nord University, Norway, Faculty Member, Federal University of Kier, Faculty of Medicine, Fortaleza, Kier, Brazil, Faculty Member, Center for Global Health, Bangladesh University of Health Science and Enterprise of the Bangladesh Diabetic Association, Dhaka, Bangladesh, former faculty member, University of Oslo, Norway, Faculty of Medicine, Department of International Health, 2002 to 2017. Dr. Akhtar Hussain is just presenting global perspective of diabetes, role of the IDF. Dr. Akhtar Hussain.
I'm Dr. Akhtar Hussain. I'm the President-elect of the International Diabetes Federation and a Professor of Diabetes and Metabolic Disorder at the Nord University in Norway. It's always a pleasure for me to talk in Diabetes India conference. I've been regularly invited, and thanks to the organizer for inviting me this year as well. I take it as a kind of big pleasure for me to talk in Indian conferences. As you know that I'm from Bangladesh, so India is very much home to me. So today, the talk of my today's presentation would be related to the global burden of diabetes and the role of the IDF, what IDF is doing. I'll be presenting some of the slides that you are quite familiar with. As you know that the diabetes trends is increasing, and it seems that there is no stop to this. And as you can see that we have about 1 in 10 people today. That means it's about 537 million people globally have diabetes. But these estimates actually do not take into account that we have about 1 in 2 adults remain undiagnosed. So 50% of the people remain undiagnosed. And we also know that this, for example, that impaired glucose tolerance rate, that the impaired glucose tolerance is about 441 million people. That is 1 in 9, every 9 people. So it's this situation that we see that is almost, it seems that this challenge is a kind of unmet challenge. And therefore, we need the global cooperation. We need the cooperation from all countries and all our member associations to fight this disease. Next one is, if you look at this, here I will try to draw the attention on, for example, on this GDM, that more pregnancies affected by hypertension, about 700,000. And this remains to be an underestimation that we all agree, because most of the people, most of the women are not diagnosed because many people still, the maternity care is outside the hospital setup. So this is a kind of grim picture I'm drawing to you, because it's not that I'm going to scare you, but it's just that how much initiative we need in order to have a discussion on this, or to have a kind of joint global collaboration to fight this condition. So the next one is if you see this number of people with diabetes, as you see that you have seen this IDF Atlas map, that it is increasing all over everywhere. And it seems that it is, but if you look at, for example, in our part of the globe, that is the South Asian. That's here you have Europe, here you have South Asia. We are expecting a kind of increase of 68% increase compared to only 13% increase in Europe. So you see that in the European side, so we see that the increase in diabetes is actually much higher in poor and middle income countries. And this creates a kind of a much bigger challenge for our healthcare system to sustain this burden of diabetes. So in summary, if I want to say in summary that in 2021, the IDF 10th edition of the Atlas estimates that 1 in 10 people, that is 20 to 79 years of age, have diabetes. This equals to 537 million people, as I say. But this number by 2024, this number will increase to 784 million people. And there are still remain gaps in our estimations due to the absence of low quality data in some parts of the world. As you know that there are many parts of the world we actually struggle to get good quality data. There is a strong need for effective intervention strategies and policies to stall the increase of the number of people with developing the diabetes. So this is the grim picture that I'm drawing. And we also know that despite of all our medical and scientific innovations, we know that there are about 4.9 million deaths per year, which is related to diabetes. And it intersects with all dimensions of development. So the diabetes is now defined as not only a disease, but it's a kind of developmental issue. It costs about 11% of the worldwide health expenditure only for diabetes. So what are the major challenges that we see from the global arena, from the International Diabetes Federation? That we see that there is a rising trend of diabetes, as I have just described here, and we need a global action for this. And the other challenge is the inaccessibility of insulin to 50% of the people with diabetes, that 50% of the people diagnosed with diabetes who needs insulin have irregular or no supply of insulin to these people. And if you see this in sub-Saharan Africa, we see only 1 in 7 people in some parts of sub-Saharan Africa, that only 7 people with diabetes have access to insulin. We also see that there is a lack of global coordination between, for example, IDF, WHO, NCDs, that because we are providing different statistics, and this calls for a kind of more united work. And I will come to tell you that what we are doing to narrow these gaps. And corporate sponsorship, as you know, that finance to the organizations, finance to the work for people with diabetes is very much sponsored by many companies. And I will tell you that this is a big challenge, and also at a global level. And united voice for the people with diabetes. As you know that the diabetes voice is being fragmented. And this is a big challenge to all that who are interested in diabetes work, that they should know that we should have one voice. I have nothing against any particular organizations who are also working on it globally, but we have to keep in mind that the organization that encompasses the whole world is International Diabetes Federation. This is the place this is your organization. It's nobody's organization, but many other organizations, you can go to Europe or to the United States. That's not your organization. You cannot be anybody in that organization. But tomorrow, you can be the president of the International Diabetes Federation. So you have to say that not your personal interest. I have nothing against that you are traveling around the world and attending conferences. They are also our member associations. So please do so. But you should remember that where is your home? You can travel around, but you must not forget that what is your home. And we also see that the policies that is being developed at a global level is not necessarily implemented at a national level. And we need to identify the barriers that why it is not implemented at a national level. Where is the gap? And then also that, as I said, that funding for non-communicable disease as a whole, not only diabetes, at a global level is far more challenging. And I will show you some of the statistics at the end. And I will appeal to all that please unite under one flag, that is the International Diabetes Federation, in order to meet the challenges that we have. If we fail today, we will be failed forever, because this problem is rising, and this problem is rising particularly in your door, in the poor and in the middle income countries. As you know that India has the second largest population with diabetes. We cannot fail. We do not have any time to have any disagreement on this issue. Now I'm coming to International Diabetes Federations. What is International Diabetes Federation? Since 1950, this federation was established, and is associated with the United Nations Department of Public Information and in official relationship with the World Health Organization and the Pan American Health Organization. As you know, that IDF championed the UN resolution on diabetes, which is a major step. And this, because this was the first time that any non-communicable disease was recognized with an UN resolution on diabetes. So this was a major breakthrough and a big achievement for all people who are working for diabetes, not only for the International Diabetes Federation. Mission of the IDF, it is to be the leading and authoritative global voice for people with diabetes and those at risk for diabetes, and improve the quality of life of all people with diabetes, prevent type 2 diabetes, and fight discrimination against all affected by diabetes. Here we should say that the IDF puts a particular emphasis on prevention, because as we know that we do not know how to prevent type 1, but type 2, we know that is the effective measures. We can effectively actually prevent 60% of the people with diabetes. As we know that in a poor countries, that when you have diabetes, then you have this disease for throughout your life. And this is a big challenge economically for many people in our part of the world to meet the needs of the family and to buy the extra cost of insulin. So prevention is the only way out, particularly for our part of the world, and to promote diabetes care, prevention, and a cure worldwide. So what IDF does we address these issues. We call the global voice of diabetes, and it is in partnership with sustainable and strong organizations of global at regional level, and policies at high quality research, policies, development, and also the presence that our visibility, the global recognized authority on diabetes. And I'll be going all these points in my next slides. So what is the vision of 2023? We are now in 2022. We need to think that we want to engage 1 million healthcare professionals by December 2023 for the work of diabetes. And this is also one of the things that I think countries like India should have a particular role to play, because we know that we have, with a kind of, is a big country with this a big health infrastructure that you have in place, that help from the Indian diabetes organizations is essential to achieve this milestone. And this is we are coming in, we started, as you know, that we started this IDF in 2019 when I was elected. We have challenging this 2021 and 2020 up to 2022 because of the COVID era. That was, as you know, there is no secret that the Busan conference was not a success for the IDF. We have neither got a visibility nor any financial benefit from this conference. We are working on the IDF School of Diabetes. We have to admit that this school was the vision of late Dr. Shaukat Sadiqat, and we recognize. And today I'm the chair of this IDF School of Diabetes. I will come more closer to it. I will describe more of this school later. IDF, the conferences that we will have in December, I hope that you all can participate in this conference that is coming in. And as you know, the best of the IDF, that is, we are also creating the kind of best of IDF, and many of your organizations are already enlisted there. So what do? We do evidence-based research. We are involving in policy and advocacy, campaign and communication, education and training, and World Diabetes Congress and debates. These are the major events that we are saying. But under this, I will show you, I'll touch some of these issues that how we are accomplishing this task. As you know that this IDF Atlas, as the world recognizes that this is the authoritative voice. Most of the people in the science or in the administration, actually they rely on the IDF Atlas. We are narrowing our discussion with the WHO that WHO produces some data at times, and they also recognized that IDF Atlas is the most authoritative voice for in this regard. So we are trying to come close, and hopefully that in near future we'll have IDF WHO Atlas. And we are working strongly because the differences that we see in terms of statistics is not a major difference. There are some small differences because the data that we are collecting is collecting from two different sources. In the countries where we do not have the national data, where we rely on self-reported data. WHO doesn't do it. On the other hand, WHO collects data from health facilities, and which is facility-based, and we do not collect from the facility-based because we think this is can be a skewed data because it's not that all the people are coming to these facilities. But these are the issues that we are discussing, and we can see that how we can make it more even, so that we can have only one statistic, so that people are not confused on these issues. As you know, that the World Diabetes Day that we have started, actually that the World Diabetes Day is started from 1991 together with the IDF and the World Health Organization. And the day was decided on November 14th in response to the rapid rise of diabetes around the world and recognition with the birthday of Sir Frederick Banting. As you know, we all know about Banting. We do not have to mention anything more. In 2007, in the General Assembly, adopted resolution of 61 and 225 design attaining 14th November as the World Diabetes Day. I think that we all should take pride that despite of our weaknesses, that the big countries, the rich countries, refused to put this resolution on the UN desk. At that time, Professor Martin Schilling was the president of the IDF. He traveled around from his country to Australia to all major countries. But finally, Bangladesh, the poor country, agreed to put this motion forward in UN, and where we got this resolution. So we see that even a small country can make a difference. So 3 year at 3, access to diabetes care is if not now, and then when? So the year 1, we want to focus on access to medicine and care. Year 2, I would like to focus on access to education, health professions, people living with diabetes. It is also important for patient education. Year 3, primary and secondary prevention. So these are the main focuses that we are doing on the World Diabetes Day. We also want to increase the global awareness of diabetes, as I've said, that insulin at 100 years. The 100 years we have been using insulin for human treatment. What happened in this time? That you see that the century of insulin presents an opportunity to raise awareness of diabetes to an unprecedented level. The development of the therapeutic insulin in 1991 was a landmark breakthrough in the history of medicine. And then questions that what we have achieved. As we said, that 50% of the people remain without access to insulin, who needs the insulin. Parts of sub-Saharan Africa, only 1 of 7 people. Is it that we can be proud of? We have a kind of shared responsibility of the local governments and the companies. With this shared responsibility, we must bring together for the betterment of humankind. With this mission, that IDF took a lead to create a WHO resolution with the support of all international partners for universal access to insulin. We had lots of difficulties, I must say, that actually the big countries, the strong countries, they actually were not in support because they were afraid that their countries are producing insulin and their market, the companies from these countries will be affected. Even though we try to give an assurance that IDF has nothing to do against any companies. We need insulin. It's not that we don't need insulin. What we need a resolution that all countries, all the governments are bounded to secure the access to insulin together, as I said, together with our partners in the industry, because we have a kind of shared responsibility. However, the resolution was passed on 27th May 2021 under the name Resolution on Reducing the Burden of Non-Communicable Diseases through Strengthening Prevention and Control of Diabetes. So it is not that what we actually wanted. It was a little bit changed, but we think that at least that we have one resolution that which we can build on. And this one you can find on IDF's reaction to the resolution and its adoption in the IDF's news article on this issue. So we are strongly working together with our international partners to create this movement. And this providing access to life-sustaining medications and monitoring. So we are also partnering with direct relief in case of any kind of catastrophe, as we are saying now, Ukraine. Sometimes ago, we have seen it for example, in Gaza, in Palestine. So we see that these things are breaking up at different times. So IDF does what we can do. Even in COVID time, we try to secure the supply of insulin with some partners like direct relief. And advocating globally for people with diabetes and those at risk. So it's a kind of advocacy work that is promoting change in diabetes and the implementation of advocacy campaigns. So we are creating some kind of advocacy body so that people are trained to say that how they can do on this particular area through regional webinars, policy briefs, outreach member states, participation to high-level meetings, collaborating with the WHO and PAO, strategic alliance with the NCD Alliance, medicine, patent pool, and global coalition for circulatory health, etc. And we also are empowering people who live with diabetes, as you are familiar with Blue Circle Voices and the young leaders in diabetes. And network is focused on ensuring that the voices of the people living with diabetes, together with their carriers and family members, are prominently heard and their concerns and priorities are taken into account. And we also created an advocacy academy. This will also give us the training of these young people for diabetes facts, project development, relevant advocacy, public speaking, and storytelling, and use of social media. So coming back to the international collaborations, what we are doing at this stage, that the WHO, as you know, that we have a diabetes compact in the WHO. And this gives us a kind of great opportunity to have closer ties with WHO. In diabetes medications, in the essential medicine list, we are enlisting some of the medications that I will come back to this. That they should be taking as a kind of essential medical, include them in the essential medicines list. In 2021, resolution on reducing the burden of NCDs through the prevention of diabetes, as you say, that we have got this resolution. Insulin pre-qualification programs that we want to create. And we want to set a target that there will be a kind of WHO conference WHO World Health Assembly on 20th 22nd of May this year. So where we want to have that IDF recommendations that 100% diagnosis of young people with type 1 diabetes should be secured, and manpower development through IDF school program. We are also collaborating very closely with the WHO. And in this, as I said, that with this WHO, that IDF and the medicine patent pool welcomes the inclusion of SGL2 inhibitors to the WHO's essential medical list, which we have secured. As you know, that during this pandemic time, that the diabetes research and clinical practice, we have issued 2 special supplement on this particular issue, diabetes and COVID-19, the IDF perspective. So this was co-edited by me and Antonio Cerullia. And on this occasion, the diabetes research and clinical also takes this opportunity to mark the 100 years of experience with insulin. So we also have a special issue on Antonio and myself, as you know that many of you from India have participated in both of these special issues. Now we are talking about this education that we have. At the moment, we have about, actually it's not 70, actually we have passed now 72,000. We are around 73,000 healthcare personnel registered. The time that I took over the office, then it was about 45,000. So we are now 73,000. So we have made a significant progress in terms of the IDF school registrations. And at the moment, we have more than 110 territories is engaged in the IDF school. And it's a rural reach is about 17%, but we see that most of the countries who are collaborating with us is low and middle income countries, and which we are very happy about, because our mission is to provide the education to the people with diabetes. And we know that rich countries have their own schools. So I think that the low and middle income countries are getting this opportunity or taking the advantage of this IDF school is a very good news. So we also have some kind of free courses, and we also have some premium courses. It's up to people. So you can have a lot of information from this school, which is without any cost. So what is the future? That the way I'm thinking? I'm thinking that there are 3 ways that we should develop this school. At the moment, we are working only on a global level, but our regions are very different. And therefore, we have to tailor our programs at a regional level. And for this, we need the cooperation of every region. So that means that the global program must be tailored, but this we cannot do it from the IDF without the cooperation from the region. And that's, but up to the national level would be difficult at this stage. So I think that I will try to take it down to regional level. And then third is the complementary. Many of our member associations has already some kind of schools that you are training your people in the field of diabetes. And then we are not competing. We'll complement. We'll say that if the need or support, we'll say that how we can complement the ongoing program. So that is the thing. We will not compete. We will not weaken our member association. We will strengthen our member associations. So, and then what are the next things that I will be saying? The revisiting the IDF guidelines for type 2 diabetes, GDM, and others. This is that the work I have started my mental mapping so that I can take over this work at the within this year. IDF will take a new initiative to revisit and update the guidelines in the light of new evidence and discoveries, which we need to do, because the last guidelines that we had one in 2012, one in 2017, which was Shaukat and they did, but that was mainly focused on the primary healthcare. So we'll have to develop, revisit, and we'll have to develop this guideline. And type 2 diabetes, GDM, and fasting. As you know that type 2 diabetes is GDM, we do not have it. We need to create, because there is no international agreement either for the diagnosis or for the treatment of GDM. And as you know that fasting and Ramadan, as I believe that people of all faiths have some kind of practice of fasting. IDF includes people of all faiths. So we cannot have Ramadan and diabetes. We will have fasting and diabetes. And for this reason, I have seen the guidelines that we have. There are many good things, but there are things that needs to be developed because every time this was developed, probably it was not properly scientifically valid documents. So we need to develop it so that the recommendations that we make, it becomes a scientifically valid document. The committee will be set up this year, then in 2022, and will complete before I leave my presidency by 2024. IDF is also expanding in China. We have entered, so we have created this IDF school in Chinese, and this is actually a very fast expanding area that you should know about. We are also making a number of webinars. For example, these are the two webinars that we have done: managing CVD and renal risk in type 2 diabetes beyond glycemic control. And as many of you know, Professor Kunti from here, and also Professor Nabi Sattar from UK, and also Professor Henry Group. And then we also have this evolving landscape in the management of type 2 diabetes. So we are creating, and these webinars are free of cost. Anybody can join, and I will urge all of you to come and join this. And last my request to you that IDF Congress that it is without you, there is no Congress. So it is your responsibility to make the IDF Congress is your Congress, to make your Congress visible success. India, we expect a lot from India because India is a big country, and it has contributed a lot to for IDF and for the